fit
et en Afrique
into that category.
s'inscrivent dans cette catégorie.
Leaders of
Les
those
dirigeants
countries
de
took
ces
command of
pays
the
ont
emergency
pris
and
la tête
communicated
de
effectively
l'urgence
with
et
their
ont
populations
communiqué de
about
façon
the
effective avec leur
measures that
population
had
quant
to
aux
be taken.
mesures à prendre.
They pursued
Ils ont
a comprehensive
poursuivi une
strategy to
stratégie
find,
globale
isolate,
pour
test,
détecter,
and
isoler,
care for
tester
cases,
et traiter les
and to
cas
trace and
et
quarantine
afin de
contacts,
tracer
and
les
were able to
contacts et mettre
suppress
en
the virus.
quarantaine pour
The
supprimer le
second
virus.
situation is
La seconde
countries in which
situation
there
est
was
la
a major
suivante.
outbreak
Des pays où il y
that
a
was
eu une
brought
flambée
under control
importante qui a
through
été
a combination
maîtrisée
of strong
grâce à
leadership
une
and
alliance
populations
d'une
adhering
direction
to
forte
key
et des
public health
populations qui ont
measures.
adhéré aux
Many
mesures de santé
countries in
publique
Europe and elsewhere
essentielles.
have
Beaucoup de pays en
demonstrated that
Europe et ailleurs
it's
ont apporté
possible
la
to
preuve
bring
qu'il était
large
possible
outbreaks under
de
control.
maîtriser de
In both
larges
of these
flambées.
first two situations,
Dans ces deux
where
premières
countries
situations
have
où les
effectively
pays ont
suppressed the virus,
effectivement supprimé le
leaders
virus,
are
les
opening up their
dirigeants
societies on a
ouvrent leur
data-driven,
société
step-by-step
de
basis
façon
with a comprehensive
progressive
public health approach
en adoptant
backed
une
by a
approche de
strong
santé
health
publique
workforce
globale
and
et en
community
s'appuyant sur
buy-in.
des travailleurs de
The
santé et
third
la
situation
communauté
we're seeing is
forte. La troisième
countries
situation est
that
la suivante.
overcame the
Les
first peak
pays
of
qui
the
ont
outbreak
maîtrisé la
but
première
having eased restrictions
la
are
première
now
flambée
struggling with
ont
new peaks and
ralenti les
accelerating
restrictions,
cases.
luttent contre
In
des
several
nouveaux
countries
pics
across the
et des
world,
cas
we are now seeing dangerous
en
increases
accélération.
in
Dans plusieurs
cases
pays dans le monde, nous
and
avons
hospital wards
assisté
filling
à
up
des
again.
augmentations de cas
It would
dangereuses
appear that
et
many
une
countries are
mise
losing
à mal des
gains made
hôpitaux. Dans
as
plusieurs
proven
pays,
measures to reduce
il semblerait
risk
que
are not
les
implemented
mesures
or
pour réduire les
followed.
risques ne soient
The
pas
fourth situation
exécutées ou
is those
suivies.
countries
Quatrième cas de
that are
figure,
in the
les
intense
pays
transmission
qui sont dans une phase de
phase
transmission
of their
intense
outbreak.
de la flambée.
We're seeing this across the
C'est ce
Americas,
que nous voyons dans les
South
Amériques,
Asia,
en Asie du
and
Sud
several
et
countries
dans
in Africa.
plusieurs pays
The
d'Afrique.
epicenter of the
L'épicentre du
virus
virus
remains in the
demeure
Americas,
dans les Amériques,
where more
où
than
plus de
50% of the
50% des
world's
cas
cases have
dans
been
le monde
recorded.
entier ont été enregistrés.
But we know from the first two
D'après les deux premiers cas de
situations
figure,
that it's
nous
never
savons
too
qu'il n'est
late
jamais trop
to bring the
tard
virus under
pour
control,
maîtriser le virus,
even if there has
même
been
s'il y a eu
explosive
une
transmission.
transmission
In
explosive.
some
Dans
cities and
certaines villes ou
regions
régions
where
où la
transmission is
transmission
intense,
est
severe
intense,
restrictions
des
have been
restrictions
reinstated to
rigides ont
bring the
été
outbreak under
remises en
control.
place afin de maîtriser
WHO is
la flambée.
committed to working with all
L'OMS
countries and
s'engage à
all
travailler avec
people
tous les pays
to
et toutes les
suppress
populations
transmission,
afin de
reduce
supprimer la
mortality,
transmission, réduire la
support
mortalité,
communities to
venir en
protect
aide aux
themselves and
communautés afin
others,
qu'elles se
and
protègent et qu'elles
support
protègent
strong
les autres,
government
et
leadership
en
and
accompagnant
coordination.
une direction gouvernementale
Let me be
forte
blunt.
ainsi qu'une
Too
coordination.
many
Je serai
countries are headed
franc.
in the
Beaucoup
wrong
trop de
direction.
pays
The
sont
virus remains
conduits
public
dans
enemy
une
number one,
direction erronée.
but
Le
the
virus demeure
actions of
l'ennemi
many
public numéro
governments
un,
and
mais les
people do
mesures
not
de nombreux
reflect of
gouvernements
this.
et des populations
The
ne le
only
reflètent
aim
pas. Le
of the
seul
virus
objectif
is
du
to find
virus
people
est
to
de trouver
infect.
des gens à infecter.
Mixed messages
Des
from
messages
leaders are
contradictoires émanant
undermining
des
the most
dirigeants
critical
sapent
ingredient
l'ingrédient
of
le plus
any
critique de
response:
toute riposte, à savoir la
trust.
confiance.
If
Si
governments
les
do not
gouvernements
clearly
ne communiquent
communicate
pas
with their
clairement
citizens
avec leurs
and
citoyens
roll out a
et
comprehensive strategy
n'élaborent
focused
pas
on
une stratégie
suppressing
globale
transmission and
centrée sur la
saving
suppression de la
lives,
transmission
if
et qu'ils restent
if
chez
the
eux lorsqu'ils
basics
sont malades,
aren't followed,
si les fondamentaux
there
ne
is
sont pas
only
suivis,
one way this
il n'y a
pandemic is going
qu'une
to go.
seule voie.
Every single leader,
Chaque dirigeant,
every single
chaque
government,
gouvernement,
and every
chaque
single person can do
individu
their bit
peut
to
faire sa
break off
part afin
chains
de
of
briser
transmission
la chaîne de
and
transmission
end
et
the
mettre un
collective
terme
suffering.
à la souffrance collective.
I'm not saying it's easy.
Je ne dis pas que cela
It's
est
clearly
chose
not.
aisée, car cela ne
I
l'est
know
pas.
that many
De
leaders
toute
are working
évidence,
in
je sais que
difficult
beaucoup de
circumstances.
dirigeants travaillent dans
I
des
know that
circonstances
there
très
are
difficiles.
other
Je
health,
sais qu'il y
economic,
a d'autres
social,
difficultés
and cultural
sanitaires, économiques,
challenges to
sociales et
wear.
culturelles dont il faut
Just
tenir
today,
compte.
the latest
Aujourd'hui,
edition
la dernière
of the
édition
State of Food
de
Security and
l'état
Nutrition in the
de
world was
la
published,
sécurité et nutrition
which
alimentaire dans le
estimates
monde qui
that
vient d'être
almost
publiée,
690
l'on estime que
million people
690
went
millions de
hungry in
personnes
2019.
sont
While
tombées dans
it's
la
too
famine en
soon to
2019.
assess the full impact of
Il est trop tôt
COVID-19
d'évaluer
The report
l'impact
estimates that
complet de la COVID-19,
130
mais le
million
rapport
more
estime
people
qu'il
may
y aura
face chronic
130 millions de personnes
hunger
de
by the
plus
end of
qui
this year.
risquent de verser dans
There
la
are no
famine
shortcuts out of
chronique
this
d'ici la
pandemic.
fin de l'année. Il n'y a pas de raccourci
We all
pour
hope
sortir
there
de
will be an
cette
effective
pandémie.
vaccine,
Nous
but
espérons
we
qu'il y
need to
aura un
focus on
vaccin
using the
efficace, mais nous
tools we
devons nous
have now
concentrer sur les
to
outils dont nous
suppress
disposons
transmission
maintenant
and save lives.
afin d'enrayer la transmission et de sauver
We
des
need
vies.
to reach
Il
a
nous faut
sustainable
parvenir à une
situation
situation
where we have
durable
adequate
où nous
control of this
aurons
virus
maîtrisé de façon
without shutting
adéquate ce
down
virus
our
sans
lives
avoir
entirely
détruit nos vies
or
complètement
lurching from lockdown
ou
to lockdown,
en passant
which
d'un
has a
confinement à un
hugely
autre, ce qui a
detrimental
un
impact on
impact
societies.
négatif
I want
sur
to
les
be straight with
sociétés.
you.
Je serai franc avec vous.
There will be no return
Il
to
n'y
the
aura pas de
old
retour à
normal
la
for the
normale
foreseeable
dans
future.
un avenir proche.
I repeat,
Je le
there will
répète,
be no
il n'y
return to
aura
the old
aucun
normal
retour à la
for the
normale
foreseeable future.
dans un avenir
But there
proche.
is
Mais
a
il y a
roadmap
une
to a
feuille de
situation
route
where
vers
we can
une
control
situation
the
où nous
disease
pourrons
and get
maîtriser
on
la
with
maladie
our lives.
et reprendre nos vies.
But this is going to require three
Ceci
things.
nécessitera trois choses.
First, a
Premièrement,
focus
se
on reducing
concentrer sur
mortality
la réduction de la
and suppressing
mortalité et la
transmission.
suppression de la transmission.
Second, an
Deuxièmement,
empowered,
une
engaged
communauté
community that takes
puissante,
individual behavior
engagée,
measures
qui prend des
in the
mesures
interest
individuelles de
of each
comportement
other.
dans l'intérêt de
And
tous.
third,
Et
we
troisièmement,
need strong
nous
government
faut des
leadership and
dirigeants
coordination of
solides
comprehensive
et une
strategies
coordination de
that are
stratégies
communicated
globales
clearly
qui soient
and
communiquées de façon
consistently.
claire et
It can
cohérente.
be done.
Cela peut
It
être
must be
fait,
done.
cela doit être
I
fait.
have said it before,
Je l'ai déjà dit
and I will
et
keep
je
saying it.
continuerai de le dire.
No matter where a
Peu
country is
importe
in
où
its
en est
epidemic
un
curve,
pays de cette
it's never
courbe
too late
épidémique,
to
il n'est
take
jamais trop
decisive
tard pour
action.
prendre une décision
Implement the basics
et une mesure
and work with community
décisive.
leaders
Mettre en
and
œuvre
all
les
stakeholders
fondamentaux,
to
œuvrer
deliver
avec les dirigeants de
clear
la
public
communauté
health
et
messages.
toutes les parties prenantes pour
We weren't
porter
prepared
des messages
collectively,
de santé publique
but
clairs.
we must use all
Nous
the tools we
n'étions
have
pas préparés
to bring
collectivement,
this
mais nous devons
pandemic under
utiliser
control,
tous les outils dont nous disposons
and we need to
pour
do it right
maîtriser
now.
cette pandémie. Et il faut le faire
Together,
maintenant.
we must
Ensemble, nous
accelerate
devons
the
accélérer
science
la
as
science
quickly as possible,
et ce, le plus rapidement
find
possible.
joint
Nous devons
solutions to
trouver des
COVID-19,
solutions conjointes à la
and through
COVID-19
solidarity,
et
build a cohesive global response. Science, solutions, and solidarity. I thank you.
Thank you, Dr. Tedros. I will now open the floor to questions, but would first like to remind you we are translating this simultaneously in the 6 UN languages, so you can ask your question in any of those, plus you can ask in Portuguese. You may listen in Hindi. For Arabic, you will need to go to Japanese, to the Korean button under the quirky Zoom system. Right, we have a lot of people on the line. My apologies, I don't think we'll get to everyone, but we'll do our best to get all your questions. The first reporter I have with a question is Sarah Newey from the Telegraph, United Kingdom. Sarah, please unmute yourself and go ahead.
Hi there. Thank you so much for taking my question. It's about the WHO mission that's in China. Just a quick one, how long are the experts there for? But also, it's been reported in some press this morning that the team is not planning to visit the Wuhan Institute of Virology. I just wondered if you could expand a little bit on what they're doing there and whether you've ruled out any potential that the virus doesn't have links to the lab. Thank you very much.
I can speak to this. Maria will maybe fill in more detail. I think I've outlined this last week. This is a preliminary advanced team that's there to work with Chinese scientists and others to lay out what the main questions and what the approach and what the studies that are going to be needed by a much larger international team that will work in collaboration with the Chinese colleagues over the coming weeks and months. I think it's important to be clear on the expectations for this preliminary mission is two of our best scientists joining our country team, but joining with Chinese colleagues to lay out that we don't expect to be at this point carrying out direct field investigations. This is not the objective of this preliminary mission. This is to understand what has been discovered already, what has been studied already, what the data that's available, and then from that to lay out what further studies need to be carried out and what international experts would be useful in engaging with and partnering with Chinese colleagues in order to do that. The length of the mission will be determined by the demands and getting to that point. But it's also important to note that our two colleagues are actually in quarantine at the moment, which is a standard operating procedure from the Chinese side, and as such are already working with NHC colleagues, the National Health Commission and Ministry of Science colleagues in a remote way, being supported by our country office. So the team already working, but working remotely because they're in quarantine. And we will keep you updated on progress with the preparations for the international mission and on preparations for that, and who will travel and will be part of that mission in due course. Maria, you may wish to just lay out some of the issues and complexities of studies and investigations like this.
Thanks, Mike. So yes, I mean, when WHO participates in missions like this, a lot of what it starts with is listening and learning, from our national counterparts. I've personally been on several missions for WHO related to different emerging infections. And if I just think back to MERS, for example, it took us more than a year to identify the intermediate host, which are the dromedary camels. But on these types of missions, what we do is we listen, we learn, we understand what has been done so far so that we can work with counterparts and with international partners to lay out what needs to be done in terms of what studies need to be done at the animal-human interface. Usually what we would like to do is have a better understanding of the initial cases that were reported, what were the types of activities that were done, and then outline studies that need to be carried out. And those studies take time. But before you can design studies that need to be carried forward, you need to understand what has been done already. And so this team will be meeting with counterparts in China, with different ministries, likely with different academics and scientists, to really determine what has been done to lay out the plan going forward and to plan that larger mission.
Thank you very much, Drs. Ryan and Dr. Van Kerkhoff. The next question comes from Agnès Pedrero from Agence France Presse. Agnès, please unmute yourself and go ahead.
Yes, hello everybody, do you hear me?
Very well. Please go ahead, Agnès.
Okay, thank you. I would like to ask you, maybe I can ask in French. Je vais poser la question en français. Voilà, les États-Unis ont officialisé la semaine dernière leur retrait de l'OMS et je souhaitais savoir comment l'OMS allait affronter l'avenir et si le docteur Tedros avait appelé le président américain et voilà, s'il lui avait parlé et qu'est-ce qu'ils avaient échangé à ce propos. Merci.
Yeah, thank you. Thank you for that question. I think we have responded previously on the same question. And we will respond maybe if there are additional issues from our side when we get the formal letter. We haven't received the formal letter yet. Thank you.
Yeah, and if I could maybe just add that the teams here at WHO, our teams around the world in 141 countries, our 6 regional offices, ourselves, our hundreds of collaborating centers around the world, our partners in Gorn, our partners in science all around the world. We are focused 100% on controlling this pandemic, on reducing, as the DG said, reducing mortality, suppressing transmission, building strong community responses to this, and assisting governments with strong coordination. That is our laser focus right now. We're also dealing with many other situations around the world. We're dealing with the situation in Syria, which many of you have seen is deteriorating. We're dealing with situations in Yemen. We're dealing with other epidemics like Ebola, again, in Equatorial Province of Congo. We're dealing with plague in Ituri in Congo. We're dealing with many, many, many emergencies around the world. That is our focus, and we trust that we will be able to continue to work in scientific collaboration. But with our wonderful collaborators in the United States in the coming months and years.
Thank you, Dr. Tedros and Dr. Ryan. The next question comes from somebody who knows what it's like to battle this virus firsthand. The good news is this is Cameron Kasimov, who was in hospital and has now recovered and is at home. Cameron, please go ahead. I'm very glad to hear you're well, and please ask your question.
Can you hear me?
Yes, we can. Please go ahead.
Hello. Yes, I got COVID-19 and 12 days I was in hospital. It was very hard days for me. And I would like to take an opportunity that the Azerbaijani doctors come here, long live Azerbaijani doctors. Dr. Tedros, I would ask to you, why antibiotics cannot kill the virus completely from my practice? And if a person who infected with the coronavirus and recovered, is it possible him to catch the virus again a second time? Thank you so much.
Yeah. Maria will speak to the detail on this. We don't know yet whether it's possible with this particular virus, whether the virus, once you've had an infection and recovered, whether one can be infected again. We do know with other coronaviruses that is the case, and there is some data out there that may suggest that immunity will wane over time, but that is not fully known at this point. Maria may have more data on some recent studies that are pointing in that direction.
Yes, thank you for the question. And first of all, we're really happy to hear that you're out of hospital. And thank you for sharing your experience. We are learning from a lot of people that their experience with COVID is a challenging one, even if you have not the most severe disease, but even with mild disease, we know people are going through some challenges. So well done on getting out of the hospital, and to so many who have been able to get out of hospital. So as Mike has said, we don't have a complete answer yet, but we do expect that people who are infected with the SARS-CoV-2 virus, the virus that causes COVID-19, they do mount some level of an immune response. And this is measured through the antibody response, whether these are neutralizing antibodies, and we're learning quite a lot about a T-cell response, which are very difficult studies to carry out. What we don't know is how strong that protection is and for how long that protection will last. And so there are a number of studies that are underway that are trying to answer these questions. There are some initial studies out of 3 countries in Europe that are looking at antibody levels over time, suggesting that they may wane after a couple of months. But again, that's early data, and so we really need more studies to better understand this. From our experience with MERS and with SARS-1, the virus that spilled over in 2003, we know that people can have an antibody response for maybe a year or even longer. But with the human coronaviruses, the ones that circulate regularly, it's much shorter than that. So it's an incomplete answer because we don't have that answer yet. But there are many scientists that are currently studying this, that are trying to help us better understand how long that protection will last.
Thank you very much. And I should tell everybody that Dr. Soumya Swaminathan has joined us as well. So my apologies for not mentioning that earlier. So our next question comes from Hong Kong, from Simone McCarthy from the South China Morning Post. Simone, can you unmute yourself and go ahead and ask your question?
Yes, thank you so much. Can you hear me?
Very well. Please go ahead.
Okay, great. I know that the scoping mission to China has already been addressed once in this briefing, so I'll keep this quick, but I was just curious to know if there was any way to provide further information about which experts were on the ground in China going through quarantine, or perhaps why that information isn't being shared. Thank you.
We don't generally announce the names of our staff who go on mission in the field for no other reason other than we just want them to get on and do their work. But we can certainly share their names with you. All I can assure you is one of the experts is a long-standing expert in the animal-human interface and has been involved in multiple investigations in the field of animal origin studies, and the other is a very accomplished epidemiologist who comes from UK academia and public health, and was one of the leading, has led many epidemiologic missions, but his latest mission was in leading the analytics cell in the field in the Ebola response in North Kivu, and so both have direct and recent experience in dealing with complex epidemiologic investigations and animal-human investigations in the field, and we wish them luck and all the support they need in order to prepare for a larger mission.
Thank you, Dr. Ryan. The next question will come from Christine from ABC News, USA. Christine, please unmute yourself and go ahead.
Hi, Christine Theodoro, ABC News. I wanted to ask a question about transmission among children. From the last notes I have, the WHO reported children seem to be less affected, experience mild disease, and are less likely to show clinical symptoms. You had previously said that children are susceptible just as adults and can transmit, but from some of the household transmission studies, you were looking at, it was very rare that a child infects an adult. And you were trying to better understand when people are infectious, how people are infectious, and how do you measure that. Today, we're seeing a report from Chief Health Officer in Victoria State, Australia, warning that extensive testing in the state revealed child-to-child transmissions are, quote, more apparent than they first thought. And in the US, as you know, there's an intense debate around that's ongoing around school reopenings. We wanted to ask if there's updated guidance for the WHO on child transmissions, whether that be child to child or child to adult. Thank you in advance.
So I can start, and perhaps Mike would like to supplement. So this is a very important question, and this is one that has been on our radar from the beginning, of course, and looking at transmission as well as severity. And so what you had said about children tend to be less affected in terms of being reported as cases, that is true, representing between 1% and 3%, in some countries up to 5% of the reported cases. To WHO. There are some seroprevalence studies that are being conducted that are looking at antibody response in children. And there are a few studies that are coming out now. Again, they're not all peer-reviewed publications, but some of those are preprint. And what we're seeing from them is that children do seem to be, we need to break down what children mean. The youngest children under 10 years old, for example, versus children over 10. And it depends on how the study broke down age. Some of them range from 5 to 9, some of them range from 10 to 14. But what we're seeing is that children in the youngest age groups have a lower seroprevalence, and those that are above 10 seem to have a similar seroprevalence to those that are among older young adults and above 20 years old, which means that they can be infected, which we've said from the beginning, but they older children. But again, there's a lot that we don't know about transmission among children. With regards to schools and advice on schools, WHO has issued guidance on the safe running of schools and making sure that certain measures are in place. We've also issued guidance on when schools, considerations of when schools can reopen, and that takes into account a lot of different factors that decision makers need to take, whether it relates to the transmission that is occurring in the local area or the catchment area of the schools, the type of school structure it has, the ability for the school to have these to be able to implement the measures like physical distancing, hand washing, etc. And so there's a number of considerations that need to take place. But as you highlighted, children do seem to be less affected, but they can be more mild disease, but in some situations they can have severe disease, and we have seen that have died.
Yes, and thank you, Maria. I think that says it all. I think we've been around if we cast our minds back over the last couple of months, we've had healthy debates and around everything from long-term care facilities to transmission in dormitories, to transmissions in airplanes, to transmission on public transport, healthcare settings, the workplace, and now schools. And Maria is absolutely correct in that we don't fully understand the full contribution of children to the overall epidemic. The fact remains that when community transmission exists and when community transmission is intense, children will be exposed to that virus, and children will be part of the transmission cycle. They will be exposed, some will be infected, and they may infect others. What we don't fully understand is the impact on those children in the long term. We know in the short term they tend to have milder infections. We don't know the impact in the long term, and we don't know to what extent they pass that infection on and infect others. But we do know that that can happen. So when we look at that, and we can have the same issues when it comes to the workplace, and we talk about employees in the workplace, and we talk about long-term care facilities and health workers in the facilities and older people and visitors, and to what extent do visitors bring the disease in, or to what extent do health workers participate in transmission. And all of this is in the setting of what's happening in the community. And in communities where transmission has been effectively suppressed, where countries have been successful in driving down transmission of the disease across the board, then you reach a point where everything is safer. The problem we have in some countries right now is that it's very difficult to determine the safety of any environment because there is just so much transmission going on that all potential environments in which people mix are essentially problematic. And that's a problem. We've all paid a heavy price. Countries around the world have gone into very serious movement restrictions, stay-at-home orders, in order to suppress the virus transmission. And as countries have opened up, in some countries, the suppression of the virus has been kept in place. Countries have opened up carefully, sequentially, in a stepwise fashion, and have strengthened their public health architecture and have strengthened their capacity to investigate clusters and suppress the disease, and in some cases implement subnational or targeted measures at movement restriction or stay-at-home orders. And in that case, schools are part of that. So yes, there is an issue around how much and to what extent children participate in transmission. There are real issues around how schools can be reopened safely, but the best and safest way to reopen schools is in the context of low community transmission that has been effectively suppressed by a broad-based comprehensive strategy. We can't move from let's deal with the schools and then we all deal with that for a week or two, and then let's deal with the workplace, or then let's deal with infection in hospitals or long-term care facilities. This is playing whack-a-mole. We have got to focus on a comprehensive long-term strategy that focuses on everything at one time. We've got to chew gum and walk at the same time, and we keep pulling ourselves down various rabbit holes. Schools are a hugely important part of this. They're a hugely important part of our social, educational architecture. They're the baseline of our civilization. But we can't turn schools into yet another political football in this game. It's not fair on our children. So we have to look at this carefully in the light of the transmission in any given country or any given setting, and we have to make decisions that are based on the best interests of our children, be it their educational or their health interests. And that must be based on data. That must be based on understanding the risks in the specific setting in which schools are. What is the community transmission and what are those risks? And my fear in this is that we create these political footballs that get kicked around the place. And it's for me, we need to get back to what the Director General has just spoken about. Comprehensive strategies, sustained commitment to broad-based virus suppression. If we suppress the virus in our society, in our communities, then our schools can open safely. And there are many So I would advise us all to look carefully at schools. We will continue to, I think we have a technical advisory group meeting coming up, Maria, and we want to speak to that. We're bringing experts together from all over the world once more to look at how we manage and open schools in a safe and effective way. But please, let us not turn this into yet another political football.
Only add that we have a technical advisory group that's been pulled together to advise on us on educational institutions, specifically around how we do this safely. And it's a global collaboration. There's a large number of scientists that are helping to advise us on this. We have our second meeting this week, and that is something that we have specifically pulled together for this, because it is such a complex issue and it is such an important issue for all of us.
Thank you very much, Drs. Ryan and Drs. Van Kerkhoff. Our next question comes from Catalan, from Nazare Romero from the Catalan News Agency. Nazare, please unmute yourself and go ahead.
Hello, can you hear me?
Very well. Please go ahead.
So thank you very much for taking my question. I'll ask in Spanish, if I may. En los últimos días hemos visto cómo se han detectado nuevos brotes en Europa, por ejemplo en España, y quería saber si les preocupan estos nuevos brotes en Europa, donde la situación parecía estar más bajo control que en otros sitios del mundo. Y también quería saber cuáles son sus recomendaciones cuando se detectan brotes locales, si recomiendan medidas de confinamiento o cualquier otra medida es mejor. Muchas gracias.
So thank you for the question. I think this is exactly what the Director General was speaking to today. And we spoke at our last press conference about this, and that in many countries that have been able to suppress transmission, there is always the possibility of resurgence. And what is really important is that the countries that have used this time and have spent the time to build this public health infrastructure, the workforce in place, the surveillance in place, the strategies in place, to act fast when there is an upsurge in cases, whether it's a small cluster or whether it's something that has an outbreak that has started, the opportunity is to act fast and to apply the same comprehensive approach, informing your public, saying where this virus is, what are we doing to suppress it, what role you can play as an individual, what role we are playing as leaders to be able to bring these outbreaks under control. And I think that if the infrastructure is in place, if that workforce is in place to find cases, test cases, isolate cases, carry out contact tracing, quarantining contacts, and putting in place perhaps some restrictive measures in a localized area. So not go into the full-on nationwide lockdown, but to really apply measures at the lowest administrative level as possible to help support the outbreak response. That is something that we see going forward. Where that can be done in a data-driven way. So there are opportunities to suppress these outbreaks, these resurgence and these pockets of activity very, very quickly. And we're seeing a number of countries really be successful in doing that very quickly. But it takes a surveillance system in place to rapidly identify the cases so that you know when you need and where you need to act fast.
Thank you very much, Dr. Van Kerkhoff. Our next question comes from China, from Ye Li, from the Geneva News Agency. Please go unmute yourself and please go ahead.
Okay, thank you for taking my question. Can you hear me?
Very well. Please go ahead.
Okay, good afternoon. I have a question about the origin of the virus. We noticed that the last week before last week, Spanish researchers tested coronavirus in wastewater sample of March last year, after the Brazil experts announced the similar findings. So based on these findings, an Oxford expert pointed out that the coronavirus may have been lying dormant across the world until emerging under favorable conditions, so rather than originating in China. So I know we have asked such kind of questions before, but I wonder what's the new learning or understanding about WHO on this issue of wasted water? Thank you.
Certainly, surveillance of wastewater is a really good way at looking sometimes at the long-term epidemiology of any disease. We use surveys of wastewater, for example, to track poliovirus around the world, and it's a very effective way of knowing where a virus is and what circulating strains are. We've certainly seen the same for cholera and other diseases. So the environmental surveillance in general is a very, very useful way to supplement human surveillance when it comes to the understanding of disease. And we congratulate our scientific colleagues for for using those methods and innovations to look at the potential that this disease was present earlier than may have been previously suspected. But when it comes to investigating human disease, and the Director General has spoken of this many times, you need to go to the epicenter and work from there. We're very, very clear. The first human cases of this disease were picked up in Wuhan, the first clusters of disease in Wuhan, China, and then subsequently spread from there. And that is where the starting point lies for a full understanding of the origins of this virus in the animal kingdom. And the animal source or the intermediate hosts have not been determined. We assume the primary host is a bat, but certainly that's also to be fully determined. But that is the source of the human cases, or the first evidence of human cases. The question remains then, what were the incident that allowed the transfer of that disease from animals to humans? Where did that occur? And that can occur in the area in which the first human cases are noticed, or can occur far away from there. We've certainly seen in Ebola and other diseases that the first human cases can be unnoticed, and then by the time you pick the disease up, it's already somewhere else. And that's been very often the case in Ebola. The first cases that are noticed are in health workers. Well, we don't assume that the bats came and bit health workers. What usually is the case is that there's a trail of cases going back over some time, and at some point, historically, there was a transfer of disease from the animals to humans. So it is a detective story in that regard, and you have to go where the data and the science leads. We keep saying we have to follow the science. And when it comes to understanding the origins of disease, you have to follow the science too. And it's really, really, really important that ultimately, and I'm sure our Chinese colleagues are doing this already, they have tremendous capacities for disease investigation and scientific understanding, that we start where the disease began in humans, or where the first cases of disease occurred in humans, and we work from there, and we keep an open mind. And it's really important that we keep an open mind. But you can't close your mind based on one or two other findings elsewhere. But that becomes a distraction. And again, you end up being led down different alleyways that are not helpful. The data and the evidence should lead where it leads. And this investigation and understanding of how the disease transmitted and where and by what animal did this disease breach the barrier to humans needs to be understood. It's extremely important that it is understood. And that investigation and that scientific understanding should start at where the first clusters of human cases were detected, and that's in Wuhan in China. Maria?
Okay, thank you.
Oh.
Thank you, Mike. Sorry, Maria. So I have another commitment, so I will leave you with my colleagues, Mike, Maria, and Soumya, and hope to see you in our next session. Thank you.
Yes, so just to supplement what Mike has said, it is as he said. We listen and we learn. We see what investigations and studies are underway. We look what surveillance has happened, and we follow the science. And so it is a bit of detective work in that sense, where you're following the clues. And there is quite some work to be done. I mean, if you think about the identification of SARS, the first SARS virus, it took over a year. If you look at MERS, it took years. If you look at MERS, that took us over a year. So it does take some time. So I think we need to manage the expectations about finding the intermediate host and how that takes place. But I think what is important is that there is this global collaboration. There's a whole network of scientists that exists globally, including scientists from China, across the US, across Europe, across many different countries, all continents, that always look for these emerging pathogens. And so there's a large amount of work that's underway. We will follow the science. We are open to following that. And I think we are all committed to find the intermediate host because of its public health importance. Knowing what the intermediate host is will help us to prevent this from happening again.
Thank you very much, Drs. Ryan and Dr. Van Kerkhove. The next question comes from Nairobi, from Sarah Joving from Devex. Sarah, could you kindly unmute yourself and please go ahead?
Thanks for taking my question. Is the incubation period and the time frame in which a test result would return positive the same? Would someone need to wait the 14 days after exposure to feel comfortable that a test result is accurate? And is the incubation time frame still believed to be a maximum of 14 days, or could it be longer?
So I can start with that. That's quite a few questions in one, actually. So well done to you. So the incubation period is the point of time where somebody is exposed to the point of time where they develop symptoms, and it's believed to be between 1 and 14 days. There are always exceptions. We should say that there's always exceptions, but the majority, the average, is between 5 and 6 days. So most people will develop symptoms within 5 to 6 days. Your question about the testing is a good one, because we often get questions in terms of our testing strategy of when is the most appropriate time to test someone. So what we do within our case definitions and our recommendations is to test somebody when they develop symptoms. However, saying that, we also recommend contact tracing. So people who are contacts go into quarantine, which means they're essentially removed from other people so that they can't pass the virus on. And some of those contacts are tested. They are tested when they develop symptoms, but some of those individuals are tested when they don't have symptoms, which is why we're seeing some asymptomatic cases being detected. If that testing is going to be done, it should be done before that 14 days is up. But it does depend on a lot of characteristics of what type of test is done, what sample is collected, whether it's an upper respiratory sample or a lower respiratory sample. So there are a lot of different factors that are in play when it comes to when is the most appropriate time to take a sample from an individual.
Just to point you well, I mean, there's some excellent publications out there around issues like this and around broader issues, but there is a very good publication in JAMA this week, which is a review of all of the key parameters around the disease, like transmission and incubation and prognosis and so many other factors, the epidemiology. And if there is probably one, it may be a little complex scientifically in parts, but for journalists out there who really want to get an overview of much of what we know right now globally around the disease, Wersing et al. Have a very good paper this week in JAMA, which kind of goes across the whole range of what we know about this disease. Because I think we said it here last week, we're all in a deluge, a tsunami of scientific publications, and sometimes when scientific colleagues synthesize that into something a bit more manageable, it makes things much easier. So I just point you to publications like that where you can pick up a lot of information regarding what we know in a more synthetic fashion. Very, very helpful indeed.
Thank you, Dr. Ryan and Dr. Van Kerkhoff. No, okay, great. So our next question is for
Maria, I think, yeah, I'm sure you can answer it as well. Dr. Tedros said the Americas remained the epicenter of the pandemic. And I'm just wondering, looking at the, really big increases in cases that we have seen, particularly over this last weekend, on a public health basis, what's gone wrong and what needs to be done as a matter of urgency?
If we look at the Americas as a whole, I think both, and the DG alluded to this, in many circumstances, countries made some progress in suppressing transmission, but certainly the reopenings in those countries have led to more intense transmission. And now a number of countries face a scenario in which there's increasing and sometimes exponential transmission, a very difficult situation to face, and not necessarily with the option to impose these so-called lockdowns again because of the economic damage and the community acceptance of those. But as Tedros said, there is no situation which cannot be faced, and I think this is the issue, is to turn and face the fire, turn and face the problem, and accept that it's going to take time. It's going to require a huge commitment on the part of government and individuals in a number of countries to turn this around. And it's not just government, it's individuals, the choices we make. I think I spoke about that last week. There are choices that we all make that can either increase or decrease the risk of transmission. But there are choices that governments make that can either increase or decrease the risk of transmission. We need to re-establish trust, communication, and strong government-led strategies that can turn this around. Some of that may require limited or geographically focused lockdowns that suppress transmission in specific areas and where transmission is frankly out of control. But that is not the case in all places. All countries in the Americas have areas in their countries in which transmission is at a reasonably low level. But some areas in almost all countries have areas of intense transmission. And in those situations, absolute individual and community adherence to social distancing, hygiene, the wearing of masks when appropriate, all of those different things. If everybody does that, then we will suppress transmission, avoiding crowded places. But if people continue to frequent crowded places without taking the necessary precautions, if people aren't practicing physical distancing, if people aren't practicing hygiene, if people aren't wearing masks in the proper settings, then the disease will continue to transmit. At the same time, governments have to support communities in that, and governments have to be, again, Tedros spoke to it very clearly. We need to be absolutely clear and consistent in our messaging to our citizens. And it's got to be easy for citizens to comply. It's got to be facilitated, and it's got to be supported. So, and within all of that, as we get control back of the disease, and I can't say this strongly enough, the countries that have put in place strong public health surveillance architecture while they've been dealing with their lockdowns are now emerging from those lockdowns in a stepwise fashion, and they're replacing lockdowns with strong public health capacity to detect, to test, to quarantine, and to treat cases. And countries that have taken that path are having relative success in continuing to suppress the virus. But as I've said here before, we need to learn to live with this virus. Expecting that we will eradicate or eliminate this virus in the coming months is not realistic. And also believing that magically we will get a perfect vaccine that everyone will have access to is also not realistic. The history of vaccines are that we can and will develop a vaccine. The question mark is, how effective will that vaccine be? And more importantly and more worryingly, who will get that vaccine? And will that distribution be fair and equitable? But as Tedros has said, there are things we can do now. There are tools we have at our disposal now. If we apply them, and if we apply them systematically, and if communities and individuals buy into that and trust that their behavior will be supported by government, and we can work together collectively to drive down and suppress transmission. The positive news in this is that in many countries, death rates have fallen, and we are getting better at treating cases. We're getting better at diagnosing cases early, and we need to continue that. We need to suppress mortality, suppress transmission. We need to support communities, and we need clear and strong government leadership. And that doesn't matter where you are, but that's all the more important in countries that are now suffering very, very exponential transmission, which is very, very worrying.
Thanks, Mike. I want to speak to the individual. So as Mike has said, it's not only about leadership, it's about individuals and what individuals do. And everyone on the planet needs to know what role they have to play and to be informed about what this virus is, where this virus is circulating, especially in the areas where you live, the areas where you work, the areas that you want to travel in. All of this is important. There's so much that you can do yourself to protect yourself from getting infected and to prevent yourself from passing the virus on to others. And please make good choices. I know that there are a lot of things that we want to be doing right now, but there aren't necessarily a lot of things that we need to be doing right now. There are many people, essential workers who cannot stay at home. There are many people who are caring for patients in hospitals who cannot stay at home. And if you can, and if you can help, and if you are asked to, please stay home. You can practice physical distancing from others. You can avoid crowded places. You can avoid places that have enclosed settings that have poor ventilation. You can clean your hands. You can practice respiratory etiquette. You can wear a mask if you cannot do physical distancing. There are so many things that you could be doing, talking to your children, explaining to them the risks. Everyone has a role to play. And this is far from over. So we all have to play our part.
Thank you very much, Drs. Ryan and Van Kerkhove. We have time for one more question. He's been waiting for a long time, and so he gets the last question. It's Jamie from Associated Press, Jamie Keaton. Jamie, please go ahead.
That's okay, Margaret. My question was for Dr. Tedros. Thanks.
Okay, well, Dr. Ryan's got an update on Ebola because last week we promised that we would give that updated situation. So Dr. Ryan, please go ahead.
Yeah, this one goes out to Helen Branswell. Sorry, Helen. The dog ate my homework on Friday. I'm back, suitably contrite. As of the 12th of July, we've had 48 confirmed cases and 3 probable cases reported from Equator Province in western DRC. We had 17 deaths of confirmed cases and the three deaths of the 3 probable cases, 11 survivors. We've had 21 affected health areas in 6 health zones in Equator. And that does, while the numbers are low, that does represent a broad geographic extent of the virus, and that is of a concern. While the numbers are quite low in each health zone, any one of those individual cases can result in amplification of disease. In terms of the areas that are affected, there are 5 zones that we've had cases in the last 21 days, and most of the zones, in fact, have had a case in the last 7 to 10 days. So we're still within that incubation period for another wave of cases in the zones of Bikoro, in Balomba, in Iboko, in Lutumbe, and in Bandaka itself. In terms of the age and sex distribution, males predominate amongst the cases. Females represent 43% of cases, and children less than 18, 6% of cases. In terms of the epidemiologic links, at the beginning of the outbreak, as is normal in many Ebola outbreaks, it's difficult to make the association between cases because sometimes there are difficult exposure histories, and particularly when people have already died. But at present, the documented, at the beginning of the outbreak in the first week, 75% of cases had no documented epidemiologic link. From the 29th of June to the 5th of July, 33% had no documented link, but all cases in the last week have had documented epilinks to other cases. That's good news. The difficult part of that is that the proportion of people who are registered and followed as contacts is less than half. And that means that half of cases are not being actively followed as contacts when they're diagnosed. And again, while the numbers of those are very, very small, that is not a good parameter. And again, in terms of deaths at community level, where we've seen 9 deaths in the community, again, they all represent opportunities for disease transmission. At the moment, as of July the 11th, we're tracking 5,580 contacts across a very, very large and difficult geographic zone with extreme logistics. We've managed on a daily basis to follow 4,977, or 89%, nearly 90% of those contacts are followed on a daily basis, which is good performance in the context of the extreme logistics in the area, but it also means that 10% of contacts are not followed, and that in itself is a concern. In terms of community alerts, we're investigating or detecting about between 500 and 600 alerts at community level every day. Of them, 25% are validated as suspect cases, and then those individuals are tested. There are still challenges in testing. We've very recently established testing capacity in Bakura, which is to the south. So we now have testing capacities in all of the affected health zones. And we have clinical capacity with partners in all of the affected health zones. Same context as North Kivu, we don't have necessarily the same security issues, but we do have very, very logistics and distance and living conditions for staff and the condition of the roads, etc. We've vaccinated thousands of people with our vaccination teams, and we're very lucky to have that and those vaccination teams in place. And equally so, therapeutics are in the field and now being actively used to treat cases. The R0 for the last 2 weeks of June was 1.7, which means, technically each case is generating more than one other case. So this is still an active, very active outbreak. And I would say it is still a great concern. The Equator province is on the River Congo. It is also across the river from 2 other countries. It is a very, very large geographic area. Communities are linked and people do travel long distances. So there are a number of features of this epidemic that are of concern. Very much thank the government of Congo for its leadership, the partners in the UN and the NGO system for the support they're providing. But I would caution everyone that while the numbers in this event are low, again, it's in the era of COVID, it's very important that we do not take our eyes off these other emerging diseases. And we saw in North Kivu and in other previous outbreaks of Ebola that these can get out of control very easily. We're very focused on continuing to support the government of Congo in eliminating Ebola once more in this situation. Thank you.
Thank you very much, Dr. Ryan. And with that, I'll close this press conference for today. We'll send the audio file, as usual, to the Globalist. And the next press conference will be on Friday. That's Friday, the end of this week.